Hello everyone, hope everyone is doing great. I've taken the liberty today to talk about one and one thing only. What is PRP? Don't mind my penmanship, it's not very good. Here at Doctors of Podiatry, we do a lot of PRP as an alternative. And for everyone out there that's been following us on all of our social media platforms, we continue to use a lot of PRP on a lot of our patients to try to really maximize their improvement and minimize any long-term complications. A lot of people have asked me to talk a little bit about PRP, so that's exactly what we're going to do here today. What is PRP? Once we've assessed the patient and once we've identified the problem, we decide whether or not the patient will be a good candidate for PRP. First thing we do is we draw blood, right? So we'll draw here a little tube, right? And again, there's different types. This is just one type of tube that we use, and we use another one. And before we get into this, I just want to be very, very clear to everyone. If there's anything that you guys can take away from this, is that not all PRP is created equal. Very important. Well, what do I mean by that? There's different types of kits out in the community, in the medical field that we use. And again, just to give you guys an idea here, a 60 milliliter tube, and this is about 10. So again, we definitely use different kits or different systems here at Doctors of Podiatry, depending on the clinical presentation. It's what will dictate which one do we use. It's not really about the volume, it's about actually the concentration. And that's what's so special about these different types of kits and systems that we use here. So the first thing that we do again is we draw blood. And once we have this, right, we'll just say the blood, okay, blood. We'll just say this is the centrifuge, okay? So in the centrifuge, we spin the blood. We may be able to spin it once, we sometimes spin it twice, or maybe even more. Again, depending on the kit that we use, depending on the volume. So it's not just very cut and dry, there's different variables. And after we spin it, because blood is made of several components, we'll go ahead and redraw this. We'll just split it right in half. So then we have, let's just say, plasma, component number one. And then number two, let's just say they're the cellular components. So the cellular components, we really don't want. So we want to focus on the plasma. Let's go ahead and erase this. And let's now just say that in here we have the plasma. What's in the plasma? Number one, water. Number two, proteins. And these are really important proteins. And number three, we'll just say important nutrients. All of these things are actually in the plasma. Very, very important. Water, proteins, and nutrients. Is everyone with me? Great. Let's take it a step further, okay? This was very general, but now let's talk about what exactly is inside the plasma. And number one, we have platelets. Inside those platelets, okay, we'll say this is a little platelet, there are important cells. Other growth factors, number one, right? Growth factors. Number two, other types of proteins, extremely important in the healing process, very general, important molecules, and lastly, something called cytokines, chemokines, and again, these very, 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 very important cells that aid in the regeneration of damaged tissues. So, Dr. Wagner, what is PRP? Once we have the plasma, right, the platelet-rich plasma with all the platelets and all the growth factors and all the proteins and all these important molecules that belong to the patient, once we have identified the problematic area, we take that plasma and we actually deliver it into the affected area. About 10 years ago, when I first graduated from residency, and I still remember the day when there was there were only a couple of systems out there that we were able to use. With time, like everything else, things have changed. So we have the good fortune of living in a very, very, very good time in respect to alternative treatments. So again, what is PRP? It's very important to understand that this is not a first-line treatment. A lot of people ask me, well, Dr. Wagner, won't this heal without it? Absolutely it will. But regardless of the acuity of the clinical presentation, whether it's something serious or not so serious, I offer it to all my patients for many, many reasons, including the fact that it belongs to the patient. We're able to harness the power of natural healing, using what we have in here to heal these problematic areas, injuries, fractures, you name it. And it's not only for sports medicine, it's not only for traumatic injuries. We're using this for everything and anything, from limb salvage to ulcerations. The sky's the limit. So this is just a little Cliff Note version of what is PRP. I hope it's been helpful and more than anything educational.